Здравствуйте, друзья! Сегодня у нас в гостях доктор Amit Kamle. Он расскажет нам о том, как студентам из Индии можно легко поступить в лучшие медицинские университеты России. Здравствуйте!
Здравствуйте.
Скажите, пожалуйста, как давно вы живете в России?
24 года.
Господи, это целая жизнь.
Конечно.
Как вам живется?
Ну, мне нравится в России. Это мой второй дом.
Какая прелесть. Я могу сказать то же самое про Индию.
Да.
Да. Я живу здесь не так долго, как вы. Наверное, самый, скажем так, сложный момент переезда в Россию для индийцев – это вопрос еды. Как вам русская кухня?
Ну, русская кухня, конечно, своеобразная. Мне нравится борщ. Иногда я сам его готовлю.
Да ладно.
С индийской приправами. Да.
А как вы прекрасно говорите на русском языке? И я так понимаю, вы очень талантливый человек. Есть ли какие-то схожие слова в русском языке и в хинди?
Я немножко на английском. I would like to tell all our friends that Russian language is not at all difficult. In Russia, we say chai, and
Yes.
in India, we say chai.
Also chai.
Also chai.
Спасибо большое, Amit. Мы переходим к официальной части нашей встречи. Don't worry, friends. We are going to talk in English.
The NEET UG counseling will begin soon. Is there a similarity in student selection criteria in Russian medical universities like the best medical colleges in India? Would it still be possible to get admissions in best medical universities of Russia, as many agents claim to enroll students in best universities of Russia?
See, whenever we talk about the top and best medical universities of Russia, the university should fulfill the following parameters. It has to be a government university. It should be in the top 5 universities in organic search. There are different parameters of ratings and rankings as per as the QS rankings, Webometrics and Times Higher Education. The education has to be affordable and in English medium. The training, teaching module and the clinical exposure has to be good. The first attempt FMG passing ratio of the university has to be excellent. The location of the university has to be in the metropolitan city of Russia, because the population in Tier 2, Tier 3 and Tier 4 cities of Russia is very less. And the university should be listed in the World Directory of Medical Schools. Now, when the students and parents search for best medical colleges in India or the best medical colleges in Russia, there are thousands of lists that pop out, but there will be several names of colleges and universities that will be present in all the lists. So if we consider India, there has to be AIMS, ZIPMER, PGI-MER, CMC Vellore. For example, in Russia, it has to be Kazan State Medical University, Volgograd State Medical University, People Friendship University of Russia, first Moscow State Medical University after Sechenov, Immanuel Kant Baltic Federal University. Now, there will be universities older and even experienced than these universities which we spoke. But perhaps if these universities come in all the lists, their academic reputation, their brand value and their infrastructure speaks for itself, because their selection criteria would be different. It would be very strict. They take students on the basis of 12th merit, NEET merit, and they also conduct their own entrances to screen the Indian students. So what happens is these universities are producing continuously and consistently high performing graduates. So if a student fulfills the criteria of this university, of course the university will grant them a seat. But if the student doesn't fulfill their selection criteria, what happens in such circumstances? Parents and students come across certain unauthorized agents who promise them seats in these universities. So parents and students have to be careful, and they have to approach only the authorized representatives of top and best medical universities of Russia to enroll themselves for the academic year.
What challenges parents of students face to get MBBS seat in Russia and MBBS seat in India?
See, if you want to get a seat in India, the only criteria to get into government medical colleges is through merit. But if we are talking about education abroad, the parent has to have trust in the child, and also the child needs to give confidence to the parents that he and she will be able to cope up. Then in India, so the scope of selection is very limited for a dream college. Many countries are offering MBBS course, but the selected country and the selected college is good or not remains uncertain. In India, the students keep on repeating qualifying examinations until the entry level, so their age also increases. So what happens is the parents also have to cope up with these age related factors. In Russia, no doubt the student is doing an MBBS course, but will he or she be able to cope up with the academics, with the curriculum, and complete the course in time? Here in India, what happens, the entry level MBBS and the investment is much higher in online training or coaching or other preparations. In Russia, the student is doing MBBS course, but there are factors like inflation and fluctuations which may affect the cost of studies. In India, there's a society pressure also, like when he or she will begin the course or their career. In Russia, the society pressure is that how can you send your son and daughter so far? And the biggest fear that an Indian parent has, like after these gaps, after so much of preparation, will he or she be able to get a government seat for MBBS in India? In Russia, the bigger question remains like, no doubt the student has got MBBS seat, but after graduating from there, will he be able to crack FMG? So if you see the questions for the parents whose children want to study in India and the children who are already planning to study in abroad, the questions remain the same, but their solutions differ.
When does the academic year begin in Russia?
The academic year in Russia begins in September.
What type of universities are available for Indian students in Russia?
So the Indian students should usually prefer to study in the government medical colleges. Predominantly, there are two types of universities in Russia. One is state universities and the others are federal autonomous universities. These universities are listed in the World Directory of Medical Schools, and after graduation, their degree is globally recognized.
How can one apply at the best Russian medical universities?
So every top and best medical university of Russia has an admission committee. So they have a very specific and strict selection criteria. Indian students should submit their 10th, 11th, 12th mark sheets and certificates, their NEET scorecard, passports, and relevant health certificates. The application form has to be carefully filled, and our managers and counselors will assist the students during filling of these forms. So once the application is put up to the university, it is carefully reviewed, and if the verification is positive, the university might grant a seat to the applicant.
If the child repeating NEET again and again is waiting for a seat in India's counseling rounds, even after average score in NEET, what should the parents do in these situations?
See, now repeating NEET is an individual choice of the student. So the problem is, like, if there is a good NEET score in merit, of course the students will wait for all the counseling rounds in India. But if the NEET score is average, and if the child is still waiting in the hope to get a seat for MBBS in India, he or she might require assistance in decision making. Parents and students are very well aware that getting into MBBS is very difficult. It's a tough course and it's a long course, and the weight and the preparation we are putting during the pre-entry phase will always add up in the later career. So many times students are adamant to repeat or take NEET again because they feel like they can focus more on their studies, they can concentrate more, and they hope that their marks would be improved, and in future they might get a seat in government medical colleges of India. Many times what happens is parents also force students to repeat NEET. Sometimes students come to a decision, parents don't come to a conclusion. Sometimes parents come to a conclusion, students like to wait. But in the whole entire process, students also have to remember that, of course, parents will expect some results from the students because they want a better life, a better career, a better prospects from their child. And in this entire situation, the role of parent is extremely important. They have to support the children, they have to motivate them to see that their physical and mental well-being. Then they have to openly discuss with the students about their problems, and the most important thing is active participation in decision making, which both the parents and students nowadays lack. So in this regard, they can get in touch with our counselors, and our counselors will help them cope up with the situation.
If the child doesn't get a seat in India after counseling rounds, can he then decide to go to Russia?
See, now the counseling in India begins from June until September. The top and best universities of Russia begin their curriculum from September. So the top and best universities might not have vacant seats in September. And even if there are some vacant seats, the possibilities for the documentation procedures, passport, visa formalities take time. Also, we are going to a foreign land, so we need to have some financial arrangements to be made. Also, there is emotional preparation, mental preparation. So early application is the key. The more you delay, the lesser chances you have of getting enrolled in the top and best university, because the procedure of Russia starts from May until August.
What is the eligibility criteria for admissions in Russian medical universities?
All the desirous aspirants should pass 12th standard with science. The open category candidates should have 50%, reserved category candidates should have 40%. Also, they should be NEET qualified. For open category, it is 50 percentile. For reserved category, it is 40 percentile, along with the caste certificate, its validity, and other relevant documents.
Why should students prefer to study in top or best medical universities of Russia than low-cost universities?
There is a myth in the Indian market that top and best universities are expensive. See, if you see the top and best medical colleges of India, they are extremely affordable, but to get into these colleges is very difficult because of the criteria set, and it is based on competition and merit alone. The same happens with Russian medical universities, which are top listed and best universities of Russia.
Why should students prefer government medical colleges instead of private medical colleges of abroad?
The affiliations, accreditations, and certifications of government medical colleges abroad matter after graduation. Private medical universities abroad are affiliated by whom is a bigger question. Then to get into a government medical college in abroad has to be through a merit system, competitive based, and even tough. So once a student fulfills that criteria, his self-respect also increases, his confidence increases, and even the society accepts that. But to study in a private university in abroad, there's a private tag attached to it, which is unsaid. Government medical colleges in abroad are affordable and secure. Now, government medical colleges abroad are affiliated with government medical hospitals which are cost effective in treatment. So, the students get a hands-on experience and good clinical exposure. Now, private medical universities in abroad are affiliated with private hospitals and their cost of treatment is higher. So, there will be restrictions in clinical exposure. Private medical universities abroad, their affiliations, accreditations, and certifications could be delisted and de-recognized also.
What is an authorized admission consultant? How university appoints a representative in a country?
See, admission consultant is appointed and authorized by a specific university in a specific country. Now, before the university appoints an admission consultant and representative, a background check of the organization is done. The track record of this representative is done. Their alumni track record, the quality of students, the experience, expertise, and knowledge in the field is checked, and then the university develops a bond of trust. So, all the parents and students have to apply to a specific university through the authorized representative of the universities only.
What are the things parents have to keep in mind before approaching any admission agents for Russia or elsewhere?
So once the student and parent has decided the choice of medical university, they have to go on the official website of the university, check the list of authorized representatives, their partners in India, because it is always advisable to apply to the medical university through an authorized consultant only. Also, the photographs with the administration or the admission committee of this representative or this consultant should be asked for, should be checked for, because many times unauthorized agents pose in front of the university with some group of students, with some local people claiming to be the official representatives of the university. Then the university always issues an authorization letter to their representatives. Can he or she speak Russian language? That has to be checked. And always the parents and students have to remember that a top and best medical university will have around 150 to 250 seats at the maximum. So why will a university appoint 1,000 agents only in India if they have limited seats?
Students studying in popular universities are failing FMGE, and this number is increasing. Why parents and students have to keep in mind about FMGE passing ratio before selection of medical universities?
So FMGE or screening test is a 300 marks test and the qualifying marks is 50%. Students who have completed their graduation in a foreign university, in order to obtain license and work in India, they have to qualify this test. Now, the FMGE first attempt passing ratio of a university is an indicator that the university has provided quality medical education. Now, there are chances that the student might pass in the second attempt, third attempt, but during that process, there's always additional training, additional preparation for that. So, all the students and parents have to check the first attempt FMGE passing ratio of a university. Now, the average of the top and best universities is very high, but there are also students going to popular and low cost universities, and their number is also increasing. But the parents also have to keep it in mind, though their number is increasing there, they are also failing in large numbers.
How do you prepare selected students for screening test?
So we have a dedicated team who trains our students right from the first year until the final year. They conduct daily tests, weekly tests, monthly tests, mock tests. grand tests, and its progress report is sent to their parents, so their parents are also updated.
How is the accommodation in Russian medical universities?
So every Russian university has different accommodation for its international students. In some universities, there will be government hostels. In some universities, students have to take private accommodation or even rent an apartment.
Is Indian food available in Russia?
The metropolitan cities of Russia offer Indian food. There are choices of vegetarian food as well as non-vegetarian food. Also, there's a choice for the Indian students to cook their own food.
Who travels with students?
Usually, I travel with the students, and we have student coordinators who travel along with the students from India until Russia.
What if the student is sick?
The students have a medical insurance, and the treatment could be covered in this insurance.
Do Russian universities have Indian textbooks in the library?
Yes, the top and best universities often have Indian books for its students in the library.
Is Russian language taught to the students?
Yes, Russian language begins from the first year until the preclinical studies, but Russian language is only for communication with the patients and the locals. The medium of instruction and examinations will be in English. However, the students are advised to check the medium of instruction of that specific university in which they are enrolled before application.
How is examination conducted and what is the passing criteria?
Every academic year has 2 semesters. We have the winter semester and the summer semester. The format of examination is practical based and theory. The passing grades are 5, which is excellent, and in percentage it is 90 to 100. Grade 4 is abbreviated as good, and it is from 80 to 90%, and grade 3 is satisfactory, which is 70 to 80%.
Is the final state exam or GOS exam conducted in English language or Russian language?
The GOS examination is conducted in English language.
How do students travel within the city?
There's a good network of transportation for our Indian students. The public transport is very well developed within the city. Bigger metropolitan cities have trams, buses, trolley buses, and metros.
What is the difference between top or best universities and popular or low-cost universities?
Top and best universities always attract the Indian students on the basis of merit and competition. Low cost and popular universities attract Indian students on the basis of low cost or budget, or sometimes based on the experiences of previously studying students. Now, the selection criteria in a top and best medical university is very strict, disciplined. So it also speaks about the academic reputation of the university and willingness of the student to study in a strict and disciplined order. In low-cost universities and popular universities, the selection criteria is based on first come, first serve basis. So even if you just qualify, they just have to give admission to fill up the desired quota. Then the teaching faculty in the top and best universities, their mentorship, their insights are very valuable because these universities are producing continuously and consistently high performing graduates. Now, no doubt a low cost university and a popular university will also have a teaching faculty, but they will not be producing graduates like the top and best universities. Now, when we speak about top and best universities, they are globally recognized. So after graduating from a top and best university, there's a respect that these graduates get, and they have an advantage of post graduation for their career. Now, a graduate from a low cost university or a popular university will always have to prove that he is worthy as well. And lastly, the cities like Moscow, St. Petersburg, Kazan, Volgograd, Kaliningrad, even if you just name the city, people know that the education in these cities is excellent and they are in Russia. But if at all, in low cost universities or popular universities, you have to tell the name of the university, the city. That means it has not attained that brand value, that reputation.